Hello everyone, welcome to my YouTube channel. So today I'm talking about colic, but before we go ahead, please follow me on YouTube, turn on your post notifications and please like this video, okay? So I'm talking about colic today. What is colic? Colic is a behavioral pattern that occurs in newborns where the child cries inconsolably, like the child just cries and cries. It is actually defined by the Wessel's rule of three, which means that it occurs around 3 weeks of age. The child can cry as long as more than 3 hours in a day. The child can cry for more than 3 days in a week. Yes, and sometimes it can last up to 3 weeks, but it usually resolves around 3 to 4 months. So what causes colic? The first thing that you have to understand is that the baby's gastrointestinal tract is immature, because it's just trying to, when the baby was in you as a mother, you were the ones digesting all the food, enzymes, and everything. And right now, the baby has to do it by his or herself. So the immaturity of the digestive system is one of the causes. You need to know that. And then also you want to ask yourself, am I overfeeding my baby? Remember that sometimes there can be a gush of breast milk and the baby keeps eating and you see your baby and the baby is still sucking, right? When the baby is being overfed, the baby can take in air. And when the baby takes in air, the air can cause abdominal discomfort and can lead to colic, which brings us to the next point, meaning that am I burping my baby? Because after feeding, you ought to put your baby, flat on the tummy and rub your baby's back until your baby burps. Sometimes the baby may burp or not. You can keep a baby on your lap and still rub the baby's back until the baby burps. And then am I bottle feeding my baby? Because when the baby is bottle fed, the baby can also take in air, which can lead to the same thing and cause colic. And then if you're also giving artificial milk, you want to ask yourself if your child is lactose intolerant, because that means maybe it's not allergic to that particular milk, so you may need to change the milk. And then sometimes the babies can have gastroesophageal reflux, which can also cause colic. Another thing you have to ask yourself as the mother that is breastfeeding, what am I eating? What am I taking? Because it's been shown that excessive intake of caffeine in the mother, cabbage, cauliflower can also increase intestinal movement, motility, and lead to colic. And then you need to also check your environment. Is anybody smoking, or am I smoking as a mother? Because tobacco contains nicotine, which leads to the production of motilin, another enzyme that will increase intestinal movement and can lead to colic. So now it brings us down to, how does a child with colic present? We usually call it the period of purple crying, which is an acronym where P stands for the peak of crying. So the peak of crying is usually around these 3 weeks of age. You means is unexpected, like you just fed your baby, you just changed the diapers. You don't expect your baby to cry, because normally when the child is born, you respond to the baby's cues. When the baby cries, oh, maybe the baby is hungry, or maybe the baby is wet. But now you've done all of that and your baby is still crying. So you means unexpected. R means the baby is resisting soothing. So you're trying to rock your baby, pacify the baby, do all of that. But none of this is working. The baby is still crying. That's R. Then P means the baby makes a pain-like face, like the baby appears to be in pain, and you can see sometimes baby can carry the legs up, the knees up. You can see the pain-like face, but then you don't really know what to do. And L means it is long-lasting. It can last for up to 3 to 5 hours straight. The baby is crying. And E means it usually occurs in the evening, right? Sometimes that's how it presents. So what are the things that you can do when your baby has colic? The first thing is just relax, right? Be calm, because it will pass. So you need to stay calm as a parent. You can't be anxious so that you don't do the wrong thing, right? But most importantly, you have to burp and burp and burp. So always make sure you burp your baby. After feeding, you burp your baby. Put your baby on your chest and burp, or on your side and burp, or even on your lap flat and burp your baby. So burping cannot be overemphasized. And then another thing you can do is practice tummy time. Tummy time is when babies are laid flat, on the bed or on their play mat. And then, it also helps with neck control. So when the babies lie flat, it helps for the gas, to be released. Another thing that you can do is just, rock your baby, or sing to the baby, or take a walk, or go for a drive. Those can help also, to allay the symptoms of colic. And then you can also practice white noise. How can you get white noise? Maybe turning on the hand dryer or the washing machine. Those white noise can also help to reduce colic. Then the thing that you should never do is to shake a baby. don't shake your baby out of frustration, because when you shake your baby, it can lead to intracranial hemorrhage, and that's a different ball game. But what you also need to do is also watch out for the red flags. So when you've done all of this and your baby is crying, you need to check for the red flags. What are the red flags? Is your baby having a fever? Is the baby having diarrhea? With the pain and the crying, is the abdomen strong, distended? You want to check out, look out for that. And then is baby behaving abnormally? Is there stiffening of the limbs? Those are red flags you need to watch out for. So if the baby is crying and there's a fever, or the baby is convulsing, or the abdomen is distended, or the baby is not able to pass gas, not able to fart, then you should also, those are red flags. You need to take your child to the hospital. Now, some people may want to give gripe water or simethicone. It's been shown that they don't work. Gripe water contains alcohol that will make your baby sleep, and then you assume that, okay, baby has finally slept, but then baby wakes up and continues crying. Okay, so simethicone and gripe water have not been shown to treat colic. So just relax, stay calm, pacify your baby, and watch out for the red flags. I hope you learned something new, because now you know you can do better. Cheers. And don't forget to like my video, subscribe to my channel, and turn on the post notifications. Bye.